But I am very, very delighted to welcome, I suppose, for our opening address, Secretary-General of the Department of Health, Robert Watt. Robert has been with us in the Department of Health since 2021, after spending 10 years as Sec-Gen in the Department of Public Expenditure and Reform. So he is well known, I know, to many of us, as he has been a public servant and advisor to the government for many, many years. An economist by background, and I'm told that I can't introduce Robert without mentioning he's a board member of the Football Association of Ireland, and that, I suppose, second to economics, I guess football is one of your other great loves, Robert. But we are very delighted to have you here today, and I invite you now to make your welcome address to the 2023 NPSO conference.
Thank you, Kate, for those words. It's fantastic. People are aware that being involved in the health service is a difficult task. Nothing compared to being involved in the board of the FAI, I should say. It makes sometimes coming into Mezzanine Plaza and working with our wonderful colleagues a great break, great relief. I get in trouble for saying that. But no, it's great to be here. Thank you, Kate, for the introduction and for all your work. I don't know how many roles or jobs Kate seems to have in the Department of Health, but they seem to be many, involved in many important work. And thank you, Kate, for all your work. At the start, to thank our colleagues in the office for organising this conference. Events like this, as we all know, take a lot of effort. And to thank you for this, a very important event. And to thank all the people who've come here today in a typical soft Dublin day. It's great to see so many people here. And it's great to be joined by my colleagues from the HSE, senior colleagues in the management team in the HSE, and particularly Bernard Gloucester. Bernard and I, as people know, have very challenging roles, very important roles, and we're absolutely determined to work as we do, work hand in glove, work together to make our health services, of which we're incredibly proud, even better and more effective for the citizens that we serve. And that's our focus, along with all of you here. Every hour we work, every day we work, every week, Bernard and I are focused on doing what we think is best, to use our experience and our talents to work with everybody in this room and all other colleagues. And that's our objective, and we're not deflected by things which are less important. So it's great that Bernard is here today to talk about things that really matter. And patient safety, of course, should be seen in the context of the services that we're delivering. I think it's always useful to remind us of the record level of activity within our health services and the enormous demands which are growing by 3 or 4% a year and which we have to meet. And I won't go through the stats and the numbers, even though as an economist, as Kate mentioned, I prefer talking about stats and numbers perhaps than other things. But the level of activity this year within the public health system will be the highest we've ever seen. 3.7 million outpatient consultations. I think about 1.7 million day case and inpatient procedures. Just think of those two numbers alone. Massive activity. Nearly everybody in our country will engage. Every family certainly will engage with our services. And these demands, we're meeting these demands. And despite growing need, this year the waiting lists, which key metric for all of us, of course, waiting lists will probably plateau or come down a little bit, thanks to the efforts of all our colleagues within the system. And that's in contrast to most other countries in the developed world. Another great metric that we're measuring on, of course, is what happens within our ED departments. And again, we're starting to see significant progress in the context of unprecedented demands. Like, we're now averaging between 27,500 presentations to the ED departments every week. It's an enormous number. And around 7,100, 7,200 people are admitted to our hospitals through the ED system. I was looking at the numbers this morning. Our colleagues are great in the Department of Health. They always send me reports at 7:30 in the morning for me to read. But there were 224 people on trolleys this morning compared to 418 the same day last year. And we're starting to see that average come down. And that's great testimony to the record investment, the commitment of our staff. And alongside that record investment, of course, we need to reform. We need to do things differently. We need to have new pathways of working. We need to embrace technology and digitalisation, and we need to learn from each other. And it was really impressive. I only spent a few minutes this morning looking at the different stands outside. It's really impressive to see the innovation and the ideas. And a number of people said to me, sort of struck with me, I can't see it's dark out there. I can't really see who said it to me. Who said these are simple ideas. I said simple ideas can make such a difference, and if we can then disseminate those, scale up those simple ideas. So somebody in a speciality in a hospital comes up with an idea, a different way of working, and to disseminate that and learn from that. And I guess this is one of the great occasions where we learn from each other, and I hope people will benefit from that today. So along with other areas I've mentioned, we've come a long way in terms of patient safety. And this year we have the patient safety legislation signed into law, and this is a landmark piece of legislation which reflects how far we've come. And I think a very important marker of the culture in which we want to embrace. And I think that's perhaps an important word, because we can have systems, we can have processes, we can have new ways of doing things, but we all need to embrace a culture of openness and transparency. I'm delighted today that we're launching the first framework for open disclosures, and this is aimed at embedding a culture of great openness and transparency, a culture of compassion and honesty with patients and families when things go wrong. I know that's very, very difficult, and I've been open with each other to learn and improve our services. And if there's one thing I'd like us all to try reflect upon today, and when we go back to our workplaces later on and tomorrow, is how can we all embrace that culture, and how can particularly we can get our colleagues to embrace that culture, particularly younger colleagues, more inexperienced colleagues are coming in, because they embrace ways of working based on what they see and what they learn, particularly from more experienced colleagues. So we know we need to have a new culture, and we're on our way, but we also need to do practical things to ensure that we enhance patient safety. And I'm not going to go through all those, but there are so many different aspects of this around training, about better training, about continuous investment in training, about learning, about listening, about use of data. When I visit different parts of the system, I'm struck all the time by people on the front line telling me that if we could access data faster, if we could use data that's available, if we could access the GP records of a patient coming in. And that's something that we're really determined, Bernard and I, that we're going to fix. And it's not about a big bang solution about electronic health records, even though that's an element of it. It's about us using the pools of data and making sure those pools of data can access to each other and are assimilated in a simple process where we all have an app or a card with a code, and when we turn up at a hospital or a health centre or a community centre or whatever the setting, the practitioner can access that information. And we think this could revolutionise our system, and particularly when it comes to patient safety issues. So there are many practical elements along with the culture, training, better sharing of data, better understanding of data, which can make an enormous difference. I know the themes today are about listening and learning. We need to recognise the importance of listening. And the National Care Experience Programme, I think, is very interesting in terms of identifying issues for us, which we can embrace then in our policies and how we go about our business. And of course, learning. And it's great that we have so many speakers here today who are going to impart to us their understanding, their insights, their perspectives, colleagues from the OECD, and very welcome to our colleague from the OECD, and others who are here today. So once again, thank you to everybody for organising this conference. Thank you for your participation. I hope people get a lot out of it, challenge and engage. And I'll finish by this, that we can be very proud of our health system. We deliver every day. And one thing I'd like all of us to do is become champions for the system. There's too much negativity out there, way too much negativity. We all need to accept our failings, try to address our failings, work on things that don't go right, but be proud of what we achieve and talk about it and champion it, because the system is fantastic. We're on a journey to make it better. I know with the help of everybody in this room, that's where we get to. Thank you very much.